Patients in the ICU, particularly those on mechanical ventilators, experience difficulties communicating with their caregivers, limiting their participation in medical decision-making. These can make their stay in the ICU more stressful for them and their caregiver, and could even negatively impact their recovery. Then, there's this possibility we encounter communication barriers. Maybe our PPE makes it hard to be understood. What if the patient is too weak to answer a series of questions? What can we do to improve communication? Here are the basics that you need to know. 1. Communication boards are visual boards that help you understand your patient's needs, thoughts, and feelings. 2. Get the patient's attention. Touch their arm or shoulder and use eye contact. 3. Speak slow, loud, and simple. Make your voice louder. Speak clearly and at a slower rate. Use simple phrases and repeat important words. 4. Establish a communication method. Find out which method is more effective. Saying yes or no, thumbs up or closed fist, head shakes or head nods, blink eyes or close eyes. Be mindful and take note of these methods. 5. Put up a sign. Help others know what your patient's established communication method is. Put it at the bedside or someplace easily seen by caregivers. 6. Recheck your patient's answer. Verify if you understood them correctly using yes and no. 7. Know the communication strategies. You can use a pen and a paper or a marker and a whiteboard for patients who can read and write. Message boards are also available as another option. Keep in mind that proper positioning is important. 8. Sanitize your boards. Wipe off boards and materials with disinfectants after every use. To avoid infection control issues, message boards are for single patient use only. Dispose properly once the patient does not need it anymore. Inviting you all to create a spark of hope for these patients by using the communication boards designed by the Philippine Association of Speech Pathologists Augmentative and Alternative Communication Special Interest Group. You may use the QR code to access these free communication boards or head over to visit the PASP Facebook page. Together, let's bridge the gaps in communication and give a voice to all.